My name is Dr. Hossein Sadeghi-Nejad, and I practice at NYU Langone in Manhattan, New York. I was originally born in Iran. I immigrated to the US after the Iranian Revolution in 1979 and have been here since. After graduating from Bowdoin College in Brunswick, Maine, I went to Montreal, Canada, and completed my medical school training at McGill University. I then moved on to San Francisco and completed my surgical internship and year of surgical residency at UCSF. Subsequently moved to Boston, completed my surgical residency and a urology residency at Boston University Medical Center. I also did a fellowship at the same institution at BU, working on male reproductive medicine and surgery. I always tell my patients and my residents that other than marrying my wife, it was probably the best decision I ever made. Urology is such a versatile field with medicine, surgery, arguably psychology, all involved and intertwined in helping patients with so many different problems, from kidney stones to incontinence to cancers and, of course, infertility and erectile dysfunction. And all of these are under the umbrella of urology, and I've been blessed to be a part of this. I'm interested in all of urology with a focus in men's health and andrology. I've been blessed for the first part of my career to have worked at a university hospital and at a Veterans Affairs hospital where I took care of a lot of patients with general urological problems and cancers. But my area of expertise and fellowship training is in male erectile dysfunction, sexual medicine, and male infertility. So those areas and the broader umbrella of men's health are really what I can describe as my passion in the field. So men's health is a passion for me. Of course, it affects all men. So it's a broad umbrella, including prostate health, erectile dysfunction, male infertility. These are areas of expertise for me, my area of fellowship training. And it is also a wonderful area because we find that although many men suffer from other pathologies, including cancers that require various types of treatments, even after successful management of their disease, they're suffering from the sequelae of the treatment, the erectile dysfunction or the infertility that may follow radiation and various treatments. And this is then our role to restore them back to their normal selves. And it's a very, very fulfilling part of medicine and urology in particular. The first thing I want my patients to know about me is that I genuinely care for their well-being. My dad was a general surgeon, and one of the first lessons I learned from him when I entered medicine was to ask myself the question, what would you want done for you? And what he told me is also ask yourself, am I doing for this patient what I would do for my immediate relatives, the people I genuinely care for? And that has been really my number one goal since I started practicing medicine. What I also want my patients to know is that I have been fortunate to have practiced medicine for the past 25 years in both an academic as well as a private setting. So I have had exposure to the latest developments in various areas of urology and men's health, but have also led a very busy private practice treating patients with various men's health issues. And I think this combination of experience as well as working with residents and being in academic medicine gives me the tools I need to offer the very best to my patients.